There was an elderly woman named Emily who lived with her son and daughter-in-law. She was a happy and energetic person, always ready to help others and make the most of life. However, everything changed when she was diagnosed with essential tremor. The shaking in her hands became more frequent and intense, and it affected her daily life. She found it difficult to do simple tasks like cooking, writing, and even holding a cup of tea. As time passed, Emily became increasingly isolated and depressed. She felt like a burden to her family and struggled to find joy in life. She withdrew from social activities and stopped participating in the things she used to love, like reading and gardening. Emily's son and daughter-in-law noticed the changes in her behavior and became concerned. One day, they decided to take her to a specialist who could help manage her condition. The specialist recommended medication and therapy to manage her essential tremor and treat her depression. Emily was hesitant at first, but with the encouragement of her family, she agreed to try the treatment. To her surprise, the medication and therapy made a significant difference in her life. She found relief from the shaking and felt more confident in her abilities. She began to participate in social activities again and rediscovered her love for reading and gardening. She also started attending a support group for seniors with essential tremor, where she met others going through similar experiences. Emily's depression slowly lifted, and she was filled with a renewed sense of purpose. She realized that she was not alone and that there was help available for her. She was grateful for her family and the specialists who had helped her through her journey. How does a parent with essential tremors feel? People with essential tremors can experience depression and feelings of unease for several reasons. The condition can affect their daily activities and limit their ability to do the things they once enjoyed. This can lead to feelings of frustration, hopelessness, and helplessness. The physical symptoms of essential tremor, such as the shaking in their hands, can also be embarrassing and cause them to feel self-conscious in public. In addition, essential tremor can also cause social isolation as people with the condition may avoid social situations or activities that they used to enjoy. This can lead to feelings of loneliness and a sense of disconnection from their community. Moreover, the stigma associated with tremors and movement disorders can also contribute to feelings of shame and guilt. People with essential tremor may feel like they are a burden on their loved ones and that they are unable to contribute to their family or community. All these factors can have a significant impact on the mental health of individuals with essential tremor and can contribute to the development of depression. It is important to understand that these feelings are common and that help is available. Talking to a mental health professional, attending support groups, and finding new hobbies and activities can help manage these feelings and improve overall well-being. How people feel when someone laughs or they hear giggles due to their essential tremor. It can be very difficult for people with essential tremor when children laugh at them due to their involuntary head movements. People with essential tremor may already feel self-conscious about their condition and the physical symptoms they experience, so having a child giggle at them can exacerbate those feelings. It can lead to feelings of embarrassment, shame, and insecurity. For some, this experience can cause them to withdraw from social situations and avoid contact with young children. They may feel like they are being judged or stigmatized, which can contribute to feelings of isolation and depression. However, it is important to understand that young children do not understand the implications of their actions. They are simply reacting to the movements they see, and their laughter is not meant to be hurtful. People with essential tremors should not take this personally and should instead focus on finding ways to manage their condition and feel more confident in themselves. It is also important for family and friends to be supportive and understanding of people with essential tremor. They can help by educating themselves about the condition and by being a source of comfort and support during challenging times. What if your wife starts joking due to my head shaking continuously? Sometimes your wife starts joking about your head shaking due to essential tremor. It can be hurtful and cause feelings of insecurity and embarrassment. Your condition is a real medical issue, and it is not something to be taken lightly. It is important to have an open and honest conversation with your wife about how her jokes make you feel. Explain to her that your essential tremor is a source of frustration and insecurity for you, and that her jokes only make those feelings worse. Encourage her to be supportive and understanding, and to help you find ways to manage your condition. It may also be helpful to educate your wife about essential tremor and the impact it can have on your daily life. The more she understands your condition, the more likely she is to be compassionate and supportive. In addition to the physical symptoms and social stigma associated with essential tremor, there are several other factors that can contribute to depression in people with the condition. 1. Limitations on daily activities. Essential tremor can make it difficult to perform simple tasks such as writing, eating, or even holding a cup. This can lead to feelings of frustration and a loss of independence. 2. Social isolation. People with essential tremor may avoid social situations or activities they once enjoyed, leading to feelings of loneliness and disconnection from their community. 3. Stigma and discrimination. The stigma associated with tremors and movement disorders can cause people to feel ashamed, embarrassed, or guilty. 4. Financial stress. The cost of treatment and the impact on their ability to work can cause financial stress for people with essential tremor. 5. Chronic pain. Essential tremor can also cause physical pain and discomfort, which can contribute to feelings of depression and anxiety. It is important for people with essential tremor to seek support from their loved ones, mental health professionals, and support groups. Practicing self-care, finding new hobbies and activities, and exploring treatment options can also help manage depression and improve overall well-being. Remember, you are not alone. Millions of people around the world live with essential tremor, and there are many resources available to help you manage your condition and maintain a positive outlook. Thank you for watching. If you found this video helpful, please like, comment, and subscribe to our channel. For more information on essential tremor and related topics, be sure to check out our website and follow us on social media. Thanks for watching. Like and subscribe.